Hello, my name is Keegan McTarian. I am presenting an educational PowerPoint regarding HIV pre-exposure prophylaxis, which is also known as PrEP. HIV PrEP is taken by HIV-negative individuals prior to possible exposure to prevent the transmission of HIV. There are currently 2 approved medications for the use of PrEP in the United States. These 2 medications are the brand name Truvada and the brand name Descovy. The generic name of Truvada is also commonly known as its abbreviation TDF/FTC. According to the Centers for Disease Control and Prevention, CDC, clinical practice guidelines that were last updated in 2017, the only recommended medication that should be prescribed for PrEP based on its proven safety and efficacy is Truvada. This presentation will focus on Truvada. Truvada for PrEP has been found to be extremely effective, about 90%, at reducing HIV transmission when taken as prescribed. According to the CDC, approximately 40,000 people are infected with HIV each year. This graph shows consistently high rates, around 82% in 2018, of male-to-male sexual contact transmission of HIV. This graph from the CDC shows the estimated prevalence of HIV categorized by race, ethnicity among men who have sex with men. Black African Americans have shown a consistently high risk, and the risk of Hispanic Latinos has increased dramatically over the past 8 years. This shows that these ethnic and racial populations are at a higher risk than white men for HIV transmission based on this data. A sexual history is recommended for all adolescent and adult patients. This is the first step to identify sexual behaviors and risks for HIV. Many providers defer the sexual history because of provider discomfort, urgent care issues, or anticipated patient discomfort. The following strategies regarding sexual history are provided by the CDC. Providers should assess their own comfort with discussing sex with patients and identify any possible biases. Providers need to be comfortable discussing sex in order for patients to feel that they can open up about their sexual behaviors. A rapport should be established prior to asking any sensitive questions. The use of neutral and inclusive terms such as partner should be used, as well as posing questions in a non-judgmental manner. One should avoid assumptions based on a patient's age, appearance, and marital status. Providers should pay attention to their body language and posture. Briefly explain why a question is being asked of a patient so that the patient does not get offended or be reluctant to answer. If a provider is unsure of a term a patient uses, ask for an explanation. Ask transgender patients for the correct pronouns or terminology. Using a transition into sensitive questions will help the flow of conversation. If someone else is in the room, ask them to step out for patients to feel comfortable answering these questions. Let the patient know that these are questions that you ask everyone. A recommended transition from the CDC is, quote, "I'm going to ask you a few questions about your sexual health. Since sexual health is very important to your overall health, I ask all of my patients these questions." End quote. The Denver HIV risk tool was developed to provide a categorical risk for HIV based on 5 risk variables. The tool has been validated to group patients into risk classifications to identify those who are at an increased risk for having an undiagnosed HIV infection. This tool can also be helpful to providers to identify those who are at the highest risk of HIV infection and therefore could discuss the option of PrEP. PrEP is indicated for men who have sex with men that are at risk for HIV acquisition. PrEP can also be indicated for a man who has sex with both men and women, someone who infrequently uses condoms during sex with one or more partners of unknown HIV status, who are known to be at risk for HIV, is in an ongoing sexual relationship with an HIV-positive partner, or history of bacterial sexual transmitted infections in the past 6 months. HIV testing, as well as the documentation of the results, is required to confirm the patient does not have HIV at the time of initiating PrEP. An antigen antibody test, antibody only, or rapid point-of-care FDA-approved finger-stick blood tests are acceptable HIV testing. Oral fluid rapid testing should not be used to screen for HIV when considering PrEP. Renal function and hepatitis B status should be resulted prior to initiating PrEP. An estimated creatinine clearance of less than 60 milliliters per minute is a contraindication to Truvada. Hepatitis B infection is not a contraindication for PrEP, but it could decrease a person's renal function. Vaccination against hepatitis B should be encouraged for all adults and adolescents, especially men who have sex with men. Screening for syphilis, hepatitis C, gonorrhea, and chlamydia are also recommended at screening. If prescribing to a female or born female patient, a pregnancy test should also be ordered. This chart is helpful in determining hepatitis B test results. Truvada is prescribed in its generic fashion of TDF/FTC, and the dosage is 300 milligrams/200 milligrams given once a day. The time from initiation of PrEP to maximum protection against HIV is still unknown. Preliminary data suggests that maximum concentrations are noted in the blood approximately 20 days after taking Truvada daily. Side effects are uncommon and most resolve in the first month of taking Truvada. Some common side effects include headache, weight loss, abdomen pain, nausea, and flatulence. Drug interactions include other antiviral medications that are listed here, as well as aminoglycosides, high-dose or multiple NSAIDs, or other drugs that decrease the renal function. These interactions can cause renal toxicities and should be monitored. Another consideration should be the use of the brand name medication Harvoni, which is used to treat hepatitis C. Truvada and Harvoni can cause drug toxicities when taken together. If the generic of Truvada is unavailable and you must prescribe the brand name Truvada, please note that there is a prescription assistance program through the manufacturer of Truvada. You can help the patient sign up at www.gileadadvancingaccess.com or call 1-800-226-2056 Monday through Friday, 9 a.m. to 8 p.m. Eastern Standard Time. This coupon code usually brings down the cost of Truvada to $0. Patients who are taking PrEP should be assessed for active HIV infection. Providers need to perform a history of signs or symptoms of active infection during the first month of PrEP with a negative or indeterminate result of an HIV test. These symptoms include fever, fatigue, myalgia, skin rash, headache, pharyngitis, cervical adenopathy, arthralgia, night sweats, and diarrhea. For follow-up care, every 3 months, an HIV, pregnancy test, and STI testing for those at risk for recurrent STIs, such as those with syphilis, gonorrhea, or chlamydia at prior visits, or those with multiple sexual partners, should be completed. Signs and symptoms of active HIV infection and assessing for side effects, adherence, and HIV risk behaviors should be completed as well. A refill of the prescription for Truvada should be given, but not for more than 90 days. Every 6 months, an estimated creatinine clearance, syphilis, gonorrhea, and chlamydia test should be obtained. Other considerations while taking PrEP include a small decline in bone density. 2 trials found that men who have sex with men had a 1% decline after starting Truvada. This decline was found to either stabilize or return to normal within the first few months of taking PrEP. Bone mineral density monitoring may be necessary in patients with a pathologic fracture or those who are at risk for bone loss. Lactic acidosis and severe hepatomegaly with steatosis have also been reported. Patients should inform their healthcare provider if they develop muscle cramps or pain, weakness, worsening GI symptoms, confusion, or jaundice. New or worsening renal function has also been reported. Renal function is checked every 6 months to monitor for this risk. Therapeutic drug monitoring can be used to determine drug levels, but is a limited test. These results only reflect very recent doses. The FDA has permitted the off-label use of Truvada during pregnancy, though data regarding safety is limited. In trials, PrEP was discontinued in pregnancy. Therefore, safety has not been adequately assessed. One concern for providers to prescribe PrEP is medication adherence. It has been found that patients overwhelmingly adhere to this regimen. Medication adherence is vital to the effectiveness of PrEP, as well as reducing the risk of drug-resistant strains of HIV. Providers and medical staff need to support patients to adhere to the regimen. Follow-up visits could be completed in a telehealth model, which could increase adherence. There are multiple reasons a patient may decide to discontinue PrEP. These can include personal choice, changed life situations that make them less at risk for HIV, intolerable toxicities, chronic non-adherence, or acquisition of HIV infection. Patients should be aware that their protection against HIV will wane after 7 to 10 days once they stop Truvada. Patients should be instructed to use alternative protective measures such as condoms to reduce HIV. Providers should document HIV status, reason for discontinuation, and recent medication adherence along with sexual behaviors during a discontinuation of PrEP visit. This concludes my presentation on PrEP. Below are the references that I used for this presentation. Please return to the SurveyMonkey website to complete the survey. Thank you for your time.